Concerns about mental health have continued for many people throughout the COVID-19 pandemic, but there could be a helping hand in your refrigerator, of all places. Joining me is registered dietitian nutritionist Annalisa Frary. She's at the new Intermountain Spanish Fork Hospital. Annalisa, thanks so much for being with us. Tell me, how does nutrition make a difference in our mental health?
There's lots of small changes that you can make to your diet to help with your mental health, especially with depression. One of those could be making sure that you get enough fruits and vegetables into your daily diet.
Okay, that's a good one. We'll start there. We've always heard eat more fruits and veggies. You are what you eat. If people aren't a huge fan of vegetables, what's your tip on working those in throughout your day?
I think lots of people don't realize how many vegetables they really do like. And one thing that I like to do with people is, hey, let's look at all the vegetable options that are out there. I think there might be one that you're not remembering. Other tip could be, finding those options that you like at the grocery store, whatever form they come in, and finding a way to fit that into a meal that you enjoy.
And we've got great fruits and veggies, fresh, even locally grown this time of year. So look for those. I am a carbohydrate gal. I admit it. I love my carbs. I love my grains. I know they're not probably the best for me, especially in large quantities. What tips do you have on grain intake?
One easy change you can make is by switching the grains you eat from refined grain options to whole grain options. Just look on the labels of the foods that you're eating for 100% whole wheat or 100% whole grain, and those will be great options.
That sounds like an easy switch right there. Okay, what about seafood and fish versus meat products?
Yeah, we've seen in the studies we've looked at that by eating more fish than some of those other red meats, that seems to lower the risk for mental illnesses such as depression.
You also give a tip on choosing dairy products that are low fat or fat-free. Also look at the labels there. And then when you're cooking at night with fat, so butter and oil, how can people decrease their fat and caloric intake when using those ingredients?
We like to recommend that people use unsaturated fats. Those are fats that you find at room temperature. They're liquid, so oils, things like that, instead of those saturated fats, which are hard at room temperature, like butter, shortening, lard, those sorts of things.
All right. Again, we're going to put all of your tips, Annalisa, on our website. People can go to fox13now.com. And as you mentioned, these are easy little things. Do it in steps, moderation, because you don't recommend just going cold turkey and changing everything in your kitchen just like that, do you?
No, not at all.
Little baby steps. It'll probably make it easier for you and your family. Give it a try and see how the total body feeling you get, the improvement. So not just physically, but mentally. The key could be in your refrigerator. Annalisa Frary with Intermountain Healthcare. Thanks so much.
Thank you.